Hi there, I'm Dr. Audrey Tai, a board-certified and fellowship-trained refractive and cataract surgeon, an ophthalmologist, and cornea specialist. And today, I'm going to go over with you my 5 top things you should never put in or around your eyes. And I bet you're going to be surprised at some of the things that I have on the list of things to avoid. Let's get right into it with number 1, Visine. Specifically, Visine Dry Eye Relief, Visine Red Eye Hydrating Comfort, and Visine Red Eye Total Comfort. Visine Red Eye Hydrating Comfort and Visine Red Eye Total Comfort contain tetrahydrozoline to reduce eye redness. Tetrahydrozoline is a chemical that temporarily constricts the blood vessels on the eye surface to reduce the appearance of eye redness. Frequent and long-term use of tetrahydrozoline can cause rebound dilation of the blood vessels on the eye surface when the eye drop is discontinued. This means the eye will appear red if the eye drop is discontinued. Now, unlike Visine Red Eye Total Comfort, some other Visine eye drops, like Visine Dry Relief, do not contain tetrahydrozoline. However, all 3 Visine eye drops I mentioned use BAK as their preservative. And as always, I recommend avoiding long-term use of any eye drops that contain BAK due to its toxicity to the surface of the eye. If you really would like to choose an eye drop from the Visine family to treat dry eyes, you would be better off choosing Visine Dry Relief Tired Eye Lubricant eye drops or Visine Dry Relief All Day Comfort, as the preservative using those 2 drops is polyquat, which is less toxic than BAK. The second thing on my list is something very simple, and I bet it's something that many of you put in your eyes without thinking about it, and it is tap water. That's right, tap water is actually not that great for your eyes. Now, in an emergency, if you've ever got something much worse in your eyes, like bleach, then certainly you can and should irrigate with tap water. But if you just have a little scratchy feeling like your eyes are dry, then don't rinse them with tap water, because that will just irritate them more. The reason for this is tap water has a lower salt concentration than your natural tears and can create a lot of irritation on the surface of your eyes. So if your eyes just feel irritated, don't flush them with the shower. Instead, rinse them with FDA-approved preservative-free artificial tears, which you can get at the drugstore. You can check out this video to learn about my top 5 recommended dry eye drops. The third one is costume contact lenses, or any contact lenses that were not prescribed for you. This includes colored contact lenses that you bought for cosplay, as well as your friends or family members' contact lenses. Maybe you wish you had a different eye color, or just want to spice up your next Halloween costume. But many over-the-counter costume contacts can severely damage your eyes and even cause permanent blindness if they're not fitted by an eye specialist. If you're wearing costume contacts for cosplay, Halloween, or other events, here's how to do it safely without damaging your eyes. Costume contacts can be worn safely if you see an eye doctor first. An ophthalmologist can measure your eyes for properly fitted contacts, assess whether or not you're a good candidate for contacts, and teach you how to care for your contacts safely. After you have been to an ophthalmologist and received a prescription, be sure to only buy costume contacts from retailers who require a prescription and only sell FDA-approved contact lenses. So why are they so bad? Remember that contact lenses are medical devices that require a commitment to proper wear and care by the wearer. If not used correctly, all contact lenses can increase your chance of an eye infection. According to the FDA's analysis of 300 counterfeit lenses, harmful bacteria are found in about 60% of costume contacts purchased online without a prescription. In addition, non-prescription costume contacts can cut, scratch, or damage your eye if they don't fit exactly right. They should be customized and tailored to each individual. Contact lenses have different shapes. They're created with different base curve, how round they are, or how flat they are, which is one reason why you go to your eye doctor to get contact lens fitting exams. So if you wear your friend's contact lenses, you don't know if the front surface of their eye is shaped the same as yours. Improperly sized lenses can cause corneal abrasion and corneal ulcers, which can lead to potentially blinding and painful bacterial infections. Costume, cosplay, or theatrical contact lenses also can let less oxygen through to the eye because the paints and the pigments that add the color make the lenses thicker and less breathable. Treating these injuries can require eye surgery, like a cornea transplant, and treatment doesn't always work. A study of more than 600 women found that 1 in 4 had used non-prescription contacts, most of them obtained from unauthorized sources, such as costume shops, salons, or novelty stores. About 60% of the wearers reported eye problems such as pain, itchiness, redness, and swelling. The rate of eye injuries rose to 88% among wearers who had borrowed someone else's lenses. Many of those with eye injuries delayed seeking medical treatment, which further put their vision at risk. If you notice redness, swelling, excessive discharge, pain, or discomfort from wearing contact lenses, remove the lenses immediately and seek medical attention from an ophthalmologist. Eye infections can become serious quickly, and sometimes the damage is never reversible. Number 4 is a lesser-known threat: laser pointers. Many people don't know this, but it's true that laser pointers can cause serious eye damage when used improperly. When a laser is shined into an eye, it can cause damage to the macula, the part of the retina that allows you to see clearly. This is called laser pointer maculopathy. With the increasing ability of laser pointers, there has been a corresponding rise in reported ocular laser injury. Between 2014 and 2018, worldwide cumulative reported laser injuries more than doubled. According to a study in the journal Ophthalmologica, there have actually been enough documented eye injuries from laser pointers to trigger a warning from the Food and Drug Administration. For safety, always choose a low-power laser, class 2 or lower, and always choose red or orange. The other colors, such as green, may have higher energy and are more dangerous. In order to avoid eye injury, never point a laser pointer at a person or animal, regardless of power, and never view a laser beam through binoculars, a magnifying glass, or microscope. Doing so may concentrate the light energy, making it more dangerous. Also, never aim a laser pointer at a mirror or reflective surface, because the reflective beam is just as dangerous as the direct beam. And of course, never allow children to use a laser pointer unsupervised. The FDA has issued a warning that laser pointers are not toys and should be used by children only under strict supervision. And the fifth and final thing to never use near your eyes is heated lash curlers. So you have all seen those heated lash curlers on Sephora or at other department stores that are either battery powered or plugged into a USB charger. I know they advertise that the heated curler can help provide an extra long-lasting lift compared to the mechanical ones. What you may not know is that they can be quite dangerous to your eyes. Your skin burns at about 118 degrees Fahrenheit and sustains second-degree burns at about 131 degrees. But the skin of the eyelids is especially thin, and it can be burned at even lower temperature. Heated lash curlers often range from 100 degrees to 150 degrees, sometimes even 200 degrees Fahrenheit. So if you accidentally touch the heated lash curler to anything, that much heat around the eye can cause lashes to fall out, burn your eyelids, or even the skin around the eye, or cause serious burns to the white part of your eye or your cornea, the clear windshield of your eyes. If there are burns to the middle of the cornea where you see out of, they can cause scarring and permanent vision loss. I would recommend not using heated eyelash curlers at all, but if you absolutely still want to use a heated eyelash curler, here are some safety tips to keep in mind. Check the exact temperature of each setting and start with the lowest temperature possible. Be careful not to put too hard on the lashes. Do not repeatedly go over the same area multiple times. This can cause heat damage. And of course, if you're unsure if a product or device is right for you, always talk to your ophthalmologist first. Well, that's it for my 5 top things that should never put in or around your eyes. I hope you find this helpful, and if you haven't learned anything new, please consider hitting the like button and subscribing to my channel to support more informative content on eye health and surgery. You can also follow me on Facebook, Instagram, and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you again for watching, and I will see you in my next video.